Hello, everyone. This is Dr. Mimi Tan. Welcome to our weight loss seminar here at Aviva. Thanks for everyone who's logged in. We'll get started. So before we get started, a couple of different things. I do want to mention that this seminar itself is going to take about 20-25 minutes for us to finish. At the end, we will have a kind of Q&A session. So at any point in time during this visit or during this seminar, if you have any questions, do just feel free to send them in through the YouTube chat. All right, so let's get started. All right. So I like to get started with these visits with a very kind of simple seeming question, and that is weight loss hard? And the answer to this question is actually a little bit more complicated, and I actually think that a lot of people have been answering this question incorrectly. I think we as a society have decided that the answer to this question is that no, weight loss isn't hard at all. All you have to do is eat a little less food. You just have to exercise a little bit more, just work a little bit harder, and weight loss should not be that hard. If you're here today, I want to congratulate you because you have heard that over and over and over again. I hear this every single day. But at some point you've paused and you've said, actually, weight loss is not easy. It's actually incredibly, incredibly hard. Is there something else that I can do for myself to make weight loss a little bit more achievable? And you're absolutely right if you say that weight loss is incredibly hard. And I'll tell you why. I like to have data and I like to have numbers. And this is a chart or a graph from the CDC, and it looks at BMI classes over the last 60 years. If you're not familiar with what BMI is a ratio of your height to your weight, and it's what we use in medicine oftentimes to gauge kind of how unhealthy someone's weight is. Now, BMI is not perfect, but we will categorize people based into kind of regular weight, overweight, or obese categories depending on your BMI. Now, according to this graph, obesity rates over the last 60 years have been steadily increasing. And that's the green line that you see here. And as of 2017, more than 40% of the US population is categorized in that obese or severely obese category. And about 30%, a little bit over 30% of people are considered in that overweight category. Again, BMI is not perfect by any means, but what this tells me is that there are well over 70% of people in the US who are probably struggling with their weight to some degree. And honestly, that number now in 2024 is probably even higher than the numbers were in 2017. And so this graph only exists because weight loss and maintaining a normal weight is incredibly, incredibly hard. This graph simply would not exist. This line shooting upwards would not exist if weight loss was something that was easy to achieve. So why is weight loss so hard? There's a lot of reasons why weight loss is hard. And I don't think we fully understand it even yet. But part of why weight loss is so hard is because there are so many different things that go into how much you weigh and go into how hard it is for someone to lose weight. Some of it is stuff that we do have some control over, right? Things like diet, things like exercise, even your support system. You do have some degree of control over all of those things. But one of the really big things that people don't have easy control over is your biology, who your parents are, what your body chemistry is, what your hormone balance is. These are all different things that we're kind of born with, and we aren't really able to do things in our daily lives to impact our biology when it comes to weight loss. And it actually is a huge contributor in terms of how hard it is for someone to lose weight. So I often have, I see patients every single day, and I ask patients about kind of their weight history and their weight loss journeys up until the point that they've met me. And what I hear over and over and over again from a lot of different people is that I have tried to lose weight over and over and over again. And sometimes people have actually lost a significant amount of weight, but they've gained it back. And what I tell all of my patients is that weight loss failure, what you've tried up until this point, it's not a moral failing. It's not because you didn't try hard enough. It's not because you needed to work a little bit harder. It's often actually just a failure against your biology. It's a failure against all those different things that are a little bit outside of your control that have made weight loss so incredibly hard up until this point. You've been fighting this uphill battle and it's exhausting and it's not very effective. So I say easy control over any of those things because we now have actually a lot more tools that are a lot more effective than just diet and exercise alone, which for the most part is what a lot of my patients have tried when they've come to meet me. And so let's talk a little bit more about some of these tools that are going to make weight loss more effective and more achievable. And we'll talk about each of these tools actually. And we'll start with diet and exercise. Now, diet and exercise by itself is not going to be a very effective means of weight loss. On average, what you can expect to lose with diet and exercise, again, by itself, is about 5% or less of your total body weight. So if currently you are 200 pounds, you can on average expect to lose about 10 pounds or maybe even a little bit less with only diet and exercise. And if you're really trying to achieve a large amount of weight loss, the efficacy of being able to do that, meaning you being able to do that and keep that weight off, is extremely, extremely low. Success in those situations is often the exception. It's definitely not the rule. So diet and exercise, again, by itself, just not very effective for a lot of people in terms of their weight loss goals. That said, diet and exercise is actually going to be an absolutely foundational tool. With any of these other tools that we talk about, diet in particular is absolutely, absolutely key. You will not be as successful and these tools will not be as effective if diet is not a piece that we pay attention to. If you're not eating the right things, if you're not eating a healthy diet, these other tools won't work as well as they should. All right. So I do want to emphasize that point because it's incredibly, incredibly important. Now let's talk about medications. This is a pretty exciting kind of piece right now because we're learning a lot of new things. There are a lot of new medications that are getting a lot of attention right now. So let's just kind of talk about medications a little bit more than some of the other things. But broadly speaking, we can divide medications into two groups. We have non-injectable medications and injectable medications. Non-injectable medications, most of these medications we've had for a very, very long time. They're medications that you take by mouth, usually like in a pill or a capsule form. And these medications, for a long time, they've been okay in terms of effectiveness. Expected weight loss with some of these non-injectable drugs are going to be right around in that 5 to 10% range. So it'll be a little bit more effective than, again, just weight loss with diet and exercise by itself, but it's not that much more effective. Now, some of these newer injectable medications, they're this class called GLP-1s. These are like the ozempics or the Wegovy's or the mounjaros and the Zepbounds. These medications are newer and they are quite a bit more effective than some of the older medications that we've had. Efficacy with these injectable drugs are going to be anywhere from 10 to 20%, which is very exciting because these are the best results that we've seen with the medication. Pros and cons when it comes to medications. I think one of the big pros when it comes to these meds is that there are quite a few different categories now that we can work with when we work with our patients. One of the downsides with these medications is that most of them do have a certain side effect profile. A lot of patients will have side effects with some of these meds, and a lot of people don't necessarily tolerate those side effects long term. And so when we start out with medications, we do often have to kind of play around and figure out what medication might work best for you. But now that we're having more and more of these medications, there's more to kind of play around with, which is awesome. Some of the downsides, I think, with medications right now is that, especially with these newer injectable medications, they are currently very undercovered by insurance. And sometimes, even when insurances do partially cover these medications, they're very, very expensive. Paying for them out of pocket for most people is just not going to be an option. Um, they're also very hard to come by right now, because of how popular they are. Oftentimes, when we do prescribe these medications, it's just really hard to even get a hold of them at any pharmacy. Another question that I have that I often get from about these medications is, what is the long-term durability? Is this something that I have to be on for the rest of my life? And the answer to that, I think, is that with these medications, we have to be looking at obesity as a chronic disease. And as with any chronic disease like high blood pressure or diabetes, we put you on a medication with the intention to keep you on that medication long term. If you stop that medication, likely your high blood pressure will come back, likely your diabetes will come back. So it's a treatment, but it's not a cure. And these medications are the same way. Likely, if you stop one of these medications after you've lost a certain amount of weight, most people are going to regain weight, okay? There's a small subset of patients who may be able to maintain that weight afterwards. So if you really want to come off one of these medications, I certainly am more than willing to try with you, but I would recommend that you do it with a provider who can watch you and kind of monitor you while you come off of these medications, all right? And so that's but generally speaking, when I start one of these medications, the intention is to keep you on that medication long term. All right, let's talk about bariatric surgery now. This is, I'm certainly a little bit biased, but this is my favorite topic to talk about. Bariatric surgery, it's going to be the most effective means of weight loss that we have available to us now. And the weight loss that you can expect with bariatric surgery is going to be anywhere between 25 to 35%, depending on basically the surgery that you get and how much you weigh when we go into surgery with you. But what really I think is one of the really amazing parts about bariatric surgery is it's not just about weight loss. We've really moved away from calling bariatric surgery, or even weight loss surgery, and we've kind of moved towards metabolic surgery because this surgery does so much more than weight loss. It addresses so many different diseases that are related to being overweight, things like diabetes, high blood pressure, sleep apnea, high cholesterol. All these different things are going to likely improve with bariatric surgery, and there's even potential that you might be cured of some of these diseases with weight loss. And so I think that is one of the really gratifying things that I see with my patients after bariatric surgery. Let's talk about who can have bariatric surgery. Looking at just the medical guidelines, I'll start with this, and it's based off of BMI, which again, BMI is not perfect, but I think if you fulfill these criteria, that is a point where it is worth talking to a provider about having bariatric surgery and seeing if that's something that can benefit you. So if you have a BMI of greater than 35, or if you have a BMI of greater than 30, and you have a disease that is related to being overweight, so things like, again, high blood pressure, diabetes, high cholesterol, sleep apnea, or even things like osteoarthritis, if you have knee pain, joint pain, those are all things that are related to being overweight. If you have something like that and your BMI is greater than 30, again, these are kind of the categories where we as a medical community have said, you are likely to benefit from bariatric surgery. And so that's that piece. Now, insurance guidelines, that's where things get a little bit complicated, but generally speaking, insurances are going to start covering bariatric surgery at a slightly higher BMI than what we as a medical community have decided on. So it does get a little bit confusing. So what I would recommend if you're considering bariatric surgery is to talk to a bariatric specialty clinic who can kind of figure out what your requirements are for paying for bariatric surgery, okay? All right, let's talk a little bit about the surgery itself. So bariatric surgery in the 21st century now, we do this laparoscopically or robotically. What we do is we make little incisions to do the entire surgery. If you had bariatric surgery many, many years ago, you may have had an open procedure, which is a big incision from your chest bone down to your belly button. That is no longer how we do it. We now make 5 to 6 small little incisions, And as you can imagine, that has done wonders in terms of both complication rate after surgery, as well as just pain and recovery after surgery as well for our patients. And so our patients do really well afterwards. Most of our patients after surgery are either going to go home the same day of surgery or they're going to go home the next day. So it's a fairly rapid recovery overall. The two surgeries that we offer are going to be the sleeve gastrectomy and the gastric bypass. And I'll talk a little bit more about each one. The sleeve gastrectomy, what we're doing with that surgery is we're taking out more than 80% of your stomach. We leave you with a thin banana-shaped stomach, and that is going to restrict how much food you can eat at one time. The other surgery that we do is the gastric bypass. With the gastric bypass, what we're doing, and this is a little harder to see on this picture, but we're turning your stomach into a small egg-sized pouch, and then we're separating that from the remainder of your stomach, and then we're also going to separate out the first 100 centimeters of your small intestine, and that is the portion that we bypass, and then we reconnect your small intestine to the egg-sized pouch. And so there is a portion of stomach and small intestine that is never going to see food, is not going to absorb food or calories either. And so by doing that, we're restricting how much food you can eat at one time with your small pouch, and then we're also restricting how much food gets absorbed at one time. Both of these surgeries are awesome. They are very effective. There are reasons why I might push a patient towards one surgery versus the other. But generally speaking, most patients are actually very good candidates for either surgery. So during your visit, we'll talk a little bit about kind of the pros and cons of each one, and then we usually decide together on what is best for you. All right. Next surgery is going to be, the next thing that I want to talk about, this actually isn't really a surgery. This is another option that we offer here at Aviva. That is not technically a surgery. It's called the endoscopic sleeve gastroplasty, or the endo sleeve, or you'll see it as ESG for short. And what we're doing with this procedure is we actually go in through the mouth, we go into the esophagus, and then we go into the stomach with a small, thin camera. And the thin camera is actually attached to this other device that allows us to suture the inside of your stomach. And we suture the inside of your stomach down so that the inside of your stomach is again in that thin banana shape that you would have with the laparoscopic sleeve. But we're not actually removing any of your stomach. With this procedure, actually, we're not making any incisions. And so recovery time is going to be faster than with either the laparoscopic sleeve or the laparoscopic gastric bypass. It's a little bit less effective than the sleeve for the gastric bypass. It's going to cause about 20 to 25% weight loss on average. And unfortunately, right now, the endo sleeve is not covered by most insurances. So it is something that most of our patients do have to pay for out of pocket. Right. But it's a very cool option that we have available. It's a very cool procedure as well. All right, so let's talk about two, I would say, misunderstandings, myths about bariatric surgery that, again, I hear almost every single day. The first one is that bariatric surgery is so extreme, and I absolutely understand where this comes from. Bariatric surgery is surgery. We are putting you to sleep, we are making incisions, and that feels very extreme to a lot of people. But that said, I want to mention that bariatric surgery is extremely safe. It is one of the safest surgeries that is done today. If you go to a hospital on any given day of the week and you just look at all the surgeries that are being done that day, bariatric surgery is going to be one of the safest surgeries that's being performed. It's on the same level of safety as a gallbladder surgery or a knee replacement. So again, it's an extremely safe surgery. And in a larger sense, what we're doing with bariatric surgery, and this is why I love bariatric surgery so much, is that we are actually preventing a lot of diseases, and we're actually treating a lot of diseases with bariatric surgery. And the idea with bariatric surgery, really the idea with any procedure, any kind of medical intervention that we do it because the benefits outweigh the potential risks or complications in the future. And with bariatric surgery, what we're doing is we are preventing so many other things from happening that might shorten your life, that might cause a lot of problems for you down the road. And so that is why we actually do bariatric surgery. It does feel somewhat extreme up front, but it saves you from a lot of other problems that might happen down the line. All right. The second thing that I hear often is that bariatric surgery is the easy way out, that bariatric surgery is cheating. And in some ways, saying that bariatric surgery is the easy way out is true. It does make weight loss easier. I can't deny that. That's kind of the point of what we're doing here is we're making weight loss easier. We're making it achievable for people. Bariatric surgery, it's not magic. It's not a magic wand that we wave and magically people lose all the weight and keep that weight off. That's not the case. Bariatric surgery and medications are all tools. They are tools that are going to make things easier for you, but you still have to put the work in. You still have to use it correctly. If you're not doing those things, it's not going to be effective. And so, again, like I said before bariatric surgery, before medications, it can feel like you're climbing uphill. What these tools do is it levels that hill a little bit and it makes it a little bit easier for you. But you still have to keep walking, you still have to keep running, biking, whatever you're doing to get up that hill, okay? All right, so this is a chart that reviews everything that we talked about, just really briefly. All right, so what is Aviva? Aviva, this is our weight management group here where we offer medications and we offer bariatric surgery and bariatric procedures. We're located in Shoreline, Washington, which is just a little bit north of Seattle. So if you were to have surgery with us, that is really the only time that you absolutely have to come here. For all of our other visits, we do offer telehealth so that we can talk the same way that you're seeing me now. Of course, I love seeing my patients in person in clinic. So if you do want to come in, I love when patients do that. But most of our patients do choose, for convenience sake, to see us via telehealth. And then I think what's more important than where we are or what we are is who are the people here at Aviva. And the people here at Aviva, I think this is so, so important because the people who are going to be helping you, and this goes beyond just your surgery team. Your surgeon, of course, is important, right? But everyone else who is helping you get to surgery and everyone who is helping you out and giving you support after surgery, that is the period where you are going to be either successful or not successful. And that is the period that is so, so important. And the people who are helping you are going to help you either to success or not. And that's why I think this is so, so important, is that aftercare piece, is us being able to support you in using this new tool, giving you the right support and the right instructions and the right things to do so that you can be successful long term. All right. And our team is amazing at what they do. And I think that is really what makes a lot of our patients so, so successful with all of these different tools. All right. So how do you schedule an appointment with us? Fairly straightforward. You go to our website, avivamd.com. You fill out just a quick questionnaire from the Contact Us page, and then we will reach out to you by a phone call in the next couple of days to kind of schedule your appointment. Okay. All right. And that is everything. We'll kind of jump into our Q&A session at this point. If you don't have access to the YouTube chat, feel free to text us at that phone number as well, and we can get your questions answered. All right, so I do see a comment here from Kristen. Why can't I get into the live stream at 7 p.m.? I know that we had to cancel our 7 p.m. seminar from a couple days ago, so that might be what we're referring to. I apologize if that was of any kind of confusion for anyone. Our next 7 p.m. seminar is going to be, I think, 2 weeks from now on Wednesday, February 21st. So if you're only available in the after hours around 7 p.m., then that would be the next seminar that we offer. All right. Let's see here. Okay, another question from another Kristen. I don't know if this is the same Kristen. I've been waiting to do a weight loss surgery, but I am so scared because and then they kind of go through some experiences of people having had issues after surgery. I'm 47, if PCOS, and I've tried everything, but I'm just so afraid. All right, I kind of summarized some of that. Well, Kristen, I, I want to say that what you feel is 100% normal. And I hear this from a lot of my patients when I first see them, that they are nervous or that they are afraid of doing something that, again, feels so extreme. I, I absolutely understand where that is coming from, and that is an absolutely actually normal thing to feel. People should feel a little bit anxious about doing something that is such a big life change, right? Um, what I would tell you is that, like I said before, bariatric surgery is extremely safe. It is one of the safest procedures that we do today. Every patient that I see, I actually calculate out kind of what complication rates look like, what death rates look like with bariatric surgery, and almost for every patient that I see, the risk for something like death is extremely, extremely low. It's usually in the range of way less than 1 in 2,000 people. And in terms of other complications, the range of any complication after surgery is going to be anywhere between like 3% and 7% for most people. And that includes any small complication, things like dehydration, bleeding, infection, just any small thing that might happen is included into that percentage. And so this surgery is actually extremely safe. Um, and what I will say is that long term, the benefits of bariatric surgery, if you fulfill some of those criteria that we talked about earlier, are so great that they outweigh some of those small risks that you are kind of taking on up front with surgery. If you look at longer term data, so data that looks at like, 10, 20 years after bariatric surgery, what we know or that we've seen is that rates for fatal heart attacks, so heart attacks that actually kill you, that decreases, bariatric surgery decreases your risk for that by almost 40%. Bariatric surgery is going to decrease your risk for over a dozen different types of cancers by, again, almost 40%. When we've looked at data long term, just in terms of death rates after 20 something years, what we know is that people who've had bariatric surgery, their death rate, so to speak, in that time period is lower by like 30%. So again, you are taking on some risk with surgery up front with surgery, but the idea is that we're saving you from a lot of complications and problems and health problems longer term. And again, I think that's a really important thing to think about when it comes to bariatric surgery. I think if you have concerns, and we can speak to some of your concerns more personally when you come in to see us during your consult, and that's what I would recommend, is just coming in to talk to us so we can talk a little bit more about that. All right. Other questions? There are some questions about just how much the surgery costs. Again, this is going to really depend on your insurance, and whether or not your insurance covers it, how much your deductible is. There's a lot of different factors into it. Thankfully, we actually have a team that will look at you specifically and kind of give you an estimate about how much surgery will cost for you. So again, if you're interested in bariatric surgery and having a discussion with us and understanding costs, contact us through the Contact Us page and we'll reach out, okay? Then there's another question from, I think this is Deidre. I'm sorry if I said your name wrong. It says, tell me more about the non-invasive balloon swallow meshed. I don't know what a balloon swallow meshed is per se, but I wonder if this person is talking about just the intragastric balloon. That's probably what they're talking about. So the intragastric balloon is another bariatric procedure that we do not offer, and I'll explain why we don't offer it. So what happens with the intragastric balloon? There's a couple of different ways that you can get it, but It's a balloon that is filled with saline, and it gets placed in your stomach, and it sits in your stomach for usually about 6 months at a time. And it fills up space in your stomach so that you cannot eat or drink very much during that time period. There's a couple of different ways that we place these balloons. We either do an endoscopy, again, one of those camera things where we go in through the mouth, go through the esophagus, and go into your stomach, and we place the balloon there, and then we inflate it there and make sure it's in a good position. I think that there are also now balloons that you can just swallow, and they expand on their own. You expand it externally. So there's a couple different ways to actually place them, but either way, you have to remove them in the end with another endoscopy. Now, they are effective when you have the balloon in place. You will be eating less. You will likely lose some weight with the balloon in place. My concern with the gastric balloon, and one of the reasons why we don't offer it, is that those balloons don't stay in you long term. They have to be removed after a period of time, after a few months. And once we remove that balloon, people generally will regain their weight back because their stomach is back into the same shape that it was before. And so it's just not a very durable procedure when it comes to weight loss. And with the balloon itself, there are risks that go into having the balloon in place. There are complications that can happen with that as well. And so my thought is that if we are exposing you to some risk and some risk for complication with the procedure, I would want that thing to be of long-term benefit for you. And for most people, the balloons are not going to give you very durable weight loss. And so it's certainly an option. There are a lot of places that offer the intragastric balloon, but I would caution anyone who wants one of those in terms of the long-term benefits. All right. All right. I think that is all the questions that we have today. All right. Thank you to everyone who's tuned in today. I hope this was a helpful session. If you have any other questions that come up, either tune into another seminar in the next couple of weeks, or if you want, you can just type them into the YouTube video after this is live and published on YouTube, and then we'll get back to you at a future session. All right. Okay.